Hi everyone, my name is Juliana and I'm a speech language pathologist. You might hear me refer to that as SLP because it's much easier to say. Speech language pathologists work in a variety of settings, including both the medical and educational settings. You probably have a speech pathologist who works at your school with things related to education. I'm a speech pathologist for people who are in the hospital, people who live in a nursing home, and for people who come to see me in a clinic, similar to how you might go to a doctor's appointment. To become a speech pathologist, I went to elementary school, middle school, graduated from high school, went to college for 4 years and earned a bachelor's degree in communication sciences and disorders. Then I applied and went to 2 more years of school to get a master's degree in speech language pathology. Then after all of that, I had a 1-year fellowship where a speech pathologist who was a lot more experienced than me supervised me for a year and helped me if I needed it, if I came across anything that I was having a hard time with. So I chose to be a speech pathologist because I knew that I wanted to work in the medical field, but I also know that I don't like to deal with anything that has to do with blood. So I tried to look for a job that met both of those requirements. I also knew that I loved language arts and English when I was in school, and speech pathology includes both language arts and science. I mostly work with people who have had a stroke or other type of brain injury, and depending on what part of the brain is damaged, there's a lot of areas of life that can be affected. So some things we work on after someone has had a stroke when they're in the hospital is improving the way that speech or words sound. Sometimes they can start to come out kind of garbled or slurred, and their friends and family members might have a hard time understanding them. We also work on finding and saying the right words and understanding and processing what others are saying. So this might look like a patient not being able to think of the word that they're looking for, or having difficulty putting a sentence together, or understanding and processing what their friends and family members are saying to them and not quite getting it. So we work on that. We also work on improving patients' thinking skills, since these can be damaged during a stroke. This might be memory, organization, problem solving. And then the last thing that we work on is swallowing. So just like how muscles in your arm or your leg can be weak if you have an injury, the muscles that are controlled by your brain for your swallowing can also be damaged. So if this happens, food or drink might go into the lungs instead of the stomach, and it might cause complications like pneumonia or choking. So you know how you might start coughing and you say, oh, that went down the wrong pipe? That happens occasionally for most people, but after a stroke, it can happen really frequently. So we work on getting those muscles stronger so that people can eat and drink safely. My favorite thing about my job is that I get to help people with 3 really important things that we do every day. So those are eating, thinking, and communicating. I think it's really rewarding to help a patient gain those skills back that they temporarily lost so that they can get back to their normal lives. Watching their progress every day, little by little, and giving patients and families hope after something scary like a stroke or a medical event is very rewarding. My teachers encouraging me and making school a priority really helped me to get to where I am today. Every day I use language arts, science, and math while I'm at work, and even though I didn't think I would, I even use social studies and geography with patients when we are working on their cognition and thinking skills. I remember thinking that science was really hard and that I would never do anything with science after I finished school because it was just tougher for me than some other subjects. But my teachers helped me persevere and learn to enjoy science. And I'm so glad that they did because it's a big part of my job now, since I have to know all the parts of the body and the brain. School also prepared me for work because I work very closely with a team of other therapists. learning how to work with other students on group projects or activities in school definitely helped with knowing how to work well with others. My boss at work trusts me to get my job done every day without monitoring me or checking in, and having a hard work ethic in school has made that a lot easier because now I can do my work regardless of if someone is checking in or monitoring on me, and it'll all be done at the end of the day. Another good skill I learned in school is to be prompt and on time for work, which is something that I had a hard time with when I was younger. I have patients and other professionals relying on me every day, so if I'm late, I'm going to make them late. I work 4 days a week from 7:30 a.m. to 4:30 p.m., but when I first started, I worked 5 days a week from 8 a.m. to 4 p.m. Speech pathologists generally have a pretty flexible schedule and only work during the day and never at night like a lot of other medical professionals, so that's something that I do appreciate. Sometimes speech pathologists do work on the weekends. Something cool about being a speech pathologist that I don't think a lot of people know or realize is that I can work with people of any and every age. So sometimes in 1 week, I might see a baby or a toddler who had something besides a stroke, someone who needs to work on developing their words or their language. And then in that very same week, I might see someone who's over the age of 100. So I really enjoy getting to interact with a lot of different types of people, and I never get bored. I didn't know what speech pathology was before I went to college, so I hope that this has sparked interest in this career for some of you. Thanks so much for listening.